Hi, I'm Dr. Matt Coward, a reproductive urologist here at Atlantic Reproductive Medicine, and I'm joined by Pete Proimos, the founder of the Filotimo Foundation, who provides financial assistance and support for patients with cystic fibrosis. Pete, we're so excited about this partnership. Thank you so much for joining us. Why don't you tell us a little bit about the foundation and who it aims to help?
Of course. The foundation, simply put, is to help people with cystic fibrosis achieve any sort of financial or medical assistance whatsoever. Our focus currently is on fertility. We focus heavily on supporting people who are trying to start a family.
The word is interesting. I was going to ask you, Filotimo, does it have a special meaning?
Filotimo is the Greek word for helping someone without anything in return. There's over 40,000 cases of cystic fibrosis in the United States alone, with another 1,000 cases reported every year. Infertility is a big issue with people with cystic fibrosis, and as they get older, starting a family becomes one of the most important things in their life. Can you tell us about CF and infertility?
First thing is the care for patients with cystic fibrosis has really progressed tremendously since the approval of a drug called Trikafta in 2019. Patients with CF are now living with much less symptoms, much healthier, less trips to the hospital, and we're seeing less lung transplants. And all of this is resulting in young couples with CF getting together and wanting to start a family. Unfortunately, patients with cystic fibrosis have a condition called congenital bilateral abscess of the vas deferens, or CBAVD. And this is where they're making sperm inside the testicles, but it can't get out. It's like being born with a vasectomy. And so they're ultimately good candidates for sperm retrieval and in vitro fertilization, or IVF.
So this is a fixable issue.
Well, yeah, with the sperm retrieval. And so this is something that we do here on site at Atlantic in our dedicated, fully outfitted male infertility operating room. I like to do these cases with oral sedation and local anesthesia. We make a small incision and we can extract sperm either from the epididymis in a procedure called a MESA or from the testicle in a procedure called a TESI. And either way, we take the sample and we pass it through a pass-through window between our operating room and the lab. And the lab is able to examine the sample for quality and for quantity and make sure that we're banking the best possible sample for later IVF. So if a patient is interested to learn more, they reach out to the Filotimo Foundation. What should they expect?
Right. It's simple. We made the process as easy as possible. You go to our website, filotimofoundation.com. You look at the eligibility section and you just fill out the form. And we take it from there. We hold your hand all through the process. We get with Atlantic, and Atlantic does what they do best.
We are so grateful for this partnership. It's amazing what you do. Your commitment to these patients is incredible. Your generosity. I mean, these patients are so lucky to have you on their side. You are really making a huge impact in the world, but especially right here in our community. So thanks for everything that you do, Pete.
You're welcome, but without Atlantic Reproductive and the partnership that we have, we can't do the surgeries. So you guys are by far the best option.
Well, clearly we make a good team. And so for any couples out there with cystic fibrosis who are thinking about growing or building a family, we'd love to meet you. So reach out and make an appointment. We look forward to getting to know you.